Hi, good afternoon. My name is Alyssa. Washing my hands. I'm going to be your nurse practitioner assessing you today. Can you tell me your name?
Brooke.
Okay, and I'm going to do a neuro exam, so I'm just going to ask a few silly questions, but we do this to everyone. Can you tell me where you are right now?
Florida.
Okay, and can you tell me, do you know the date?
October 19th.
Perfect. And how are you feeling today overall?
I feel okay.
All right, good. So to start, I did her neuro exam, so she's A&O times 4, so she knows person, place, and time, and she's, general constitutional, my assessment of her, she's looks well dressed, there's no abnormalities from inspecting her generally. When I came in the room, she answered my questions correctly, so neuro-wise, she is intact, following commands, and responding appropriately. So we're going to start with your GI assessment. So first I am going to inspect your abdomen. So if you can actually just lift up your shirt. Good. So I don't see any masses, visible lesions, or anything abnormal. Skin's intact, normal color tone for her ethnicity. So that's good. For next, I'm going to start with auscultation. So I'm actually going to have you lay flat. So if you can... All right, so again, I'm going to begin with auscultation. So I'm just going to start in the right upper quadrant and work my way clockwise. Okay, good. All right, so I'm hearing bowel sounds every 5 to 10 seconds, so normal gurgle. I don't hear any high-pitched sounds. If I did, I would be concerned for obstruction, and if I heard no bowel sounds, I would be concerned for an ileus. But like I said, they are occurring every 5 to 10 seconds. Next, I'm just gonna auscultate her aortic, renal, and iliac arteries. And I should not be hearing any bruit. Sorry. And then I'm gonna go on to the next artery. And the renal. Okay, good. So again, I don't hear any brewery, so that is good. Next, I'm going to percuss, and I'm going to start with the liver, and I should be hearing dull sounds for the liver. So I'm going to start next to the mid umbilicus, and then work my way up. So. Okay, and I'm hearing dull sounds, so that is good. Next, I'm going to go to the spleen, which is the left upper quadrant, and for this, I should be hearing tympanic sounds as well. So, and it's going to be the mid clavicular line, and again, hearing tympanic sounds, so that's good. And then for the costovertebral, I'm going to also do that. So I'm going to have you sit up, and I'm just going to percuss on the back above her kidneys. Okay. And also, are you having any tenderness or pain back here?
No.
Okay. And what about when I press?
No.
Okay. So I'm good to go. I always want to make sure that they're not in any pain before I start percussing or palpating anything. Does that hurt?
No.
Okay. So no tenderness in the CDA area. Good. Okay. You can lay back down. So next, I'm going to go into palpation. So I'm going to begin with light, and then work my way to deep palpation. And again, I don't see any distension, belly is not firm, no rebound tenderness, and she's not guarding. So normal expected findings for that as well. So I'm just gonna start in the right upper quadrant and work my way. So, any pain?
No.
So for light palpation, expected findings, again, belly is soft. Next, I'm going to palpate a little bit deeper, and we're gonna then move on to feel her spleen and liver, and I should not be able to feel her kidneys. So I'm gonna go in the right quadrant again and palpate. Good, and just sit up for me again. And I'm gonna have you take a deep breath. Again, not feeling her kidneys, so that's good. You can lay back down. And then I am going to just test for Murphy sign. So that's going to be, if she has right upper quadrant pain. While I do this, I would be suspicious for cholecystitis or gallbladder issues. So I'm going to palpate deeply, so it's going to be a firm pressure, and I'm just going to have you take a deep breath. And that's going to be under her rib cage. So I'm going to go here, take a deep breath. Did that hurt?
No.
Okay, good. So negative for Murphy. Okay, so for the obturator side, I'm actually going to have you lay back down. And I'm going to lift your left leg up, and then, or right leg, I'm sorry, and see if she has discomfort, because the appendix lies on top of your obturator muscle. So if when I manipulate her muscle up to the right, she would feel pain, and I would be concerned for appendicitis. So this would be the obturator sign. So I'm just gonna have you bend this 90 degree, and I'm just gonna go diagonal, trying to keep the knee straight. Do you have any pain?
No.
No, okay, good. All right. I'm just gonna do her abdominal reflux since I'm in the GI area. So when I put this pen like on her belly, I should see a bit of a flexion between her, like by her umbilicus. Perfect. So abdominal reflex is intact. Next we're gonna go into the cranial nerve. So I'm gonna have you sit up, and we're gonna do cranial nerves 1 through 12. So we're gonna start with 1, which is olfactory, which is her sense of smell. So I'm gonna have you close your eyes, and then just tell me what you smell. Sorry, what did you smell?
A Marky, a Sharpie.
Okay, good. So sense of smell is intact. Next, we're gonna go into her optic nerve, so which is her visual fields with her vision. So I'm gonna have you close one eye, and then I'm gonna come on this side. This table's in my way. I'm gonna have you tell me how many fingers that I'm holding up.
2.
Can you move this way?
Yeah.
Sorry. All right. How many?
2. 1. 3.
Good. Okay. So optic nerve is intact. Next, we're gonna go on to ocular motor. So this is gonna be her 6 cardinal fields of vision. So we're gonna be assessing her extraocular movement. So I'm gonna ask you to just follow my finger with your eyes. Don't move your head. Good. Okay. And this would also be her pupil response as well. So I'm just going to okay. So I'm just gonna test pupillary constriction. See, just look at my nose. Good. Okay, so both pupils are equal, round, and reactive to light, and they constrict, so that is good. Next will be nerves 3, 4, and 6, actually, is kind of together with the eye stuff. So the ocular motor, trochlear, and abducens. Next, we're gonna go to cranial nerve 5, which is trigeminal. Okay, so I have 2 Q-tips, so we're gonna be assessing sensation. So just close your eyes and tell me if you feel the sharp or dull side or soft side.
Soft. Soft. Hard.
All right, so, and then just, can you open your mouth and close it? Good, open again and close it. And then can you, we're gonna go on to cranial nerve 7, which is the facial. So again, can you give me a smile? So this is assessing her movement. Good. I see a symmetric smile, no droop or anything abnormal with that. So that nerve is intact. Next, we're going to go into 8, which is vestibulocochlear. So this is her hearing. So as my previous video, we did rubber and Winnie tests previously, which were intact. So her hearing is good. And then next, we're going to do glossopharyngeal. So this is her gag reflex, and also assessing the uvula, making sure it's midline. So can you just stick out your tongue for me? And then I would shine a light, open your mouth and stick out your tongue, and good. And so her uvula went up, so that is good. And then I'm gonna have you, we're gonna do gag reflex, so just cough, like I know you have a gag reflex, so just pretend. Okay, so she has a gag reflex. Next we're gonna go on to the vagus nerve, which is cranial nerve 10. So just stick out your tongue and then move it side to side. Good. So no abnormalities there. And then next we're gonna do the spinal accessory nerve. So this is head movement. So I'm gonna have you turn your head to the left and then to the right, and then put your head chin to your chest and back. Good. And we're gonna, good range of motion with that, but we'll get into that later. I'm gonna have you turn to your right with just my hand, so with resistance. Good. Another way. Good. So resistance on both sides. So that is good for cranial nerve 11. And last one is the hypoglottial. So this is the tongue, again, stick out and move. Good. Okay. That's it for cranial nerves. We are going to move on to our range of movement for the patient. So at first we're just, again, I saw her move her neck. So the neck is intact, moving left and right, up and down, and also against resistance. We're gonna go on to shoulders. So can you just shrug your shoulders up against my resistance and then back down, and then without resistance, shrug them up and back and forward. Good. So general range of motion is intact, no abnormalities there. And then for elbows, I'm gonna have you just flex your arms 90 degree, and then can you just push towards me? Good. And then put them in the front and push away. Perfect. So neck, shoulders, and elbow range of motion is intact. Next, we're gonna go on to her reflexes. So we're gonna be assessing her tricep reflex, bicep, and then the brachial radialis. So first, I'm gonna locate her brachial and radial pulses. So I'm gonna have you put out your arm, and the radial pulse would be on the side by her thumb. And I do feel a 2+ pulse, which is the normal expected findings. It's not bounding, it's not thready, normal expected finding for a pulse. And then I'm just gonna, maybe if you could take out your sleeve, your arm, yeah. For her brachial, it's just at the elbow or the middle, sometimes a little higher. And again, 2+, which is normal. So for next reflexes, okay, all right, so reflex hammer, I'm going to assess her, if you just put out your arm, first the brachial, so just up, perfect, so that is intact. Next, we're gonna just do this over here, her hand flexed, also intact, and then I'm going to have you go like this, and then perfect, so reflexes there are intact. Next, we're going to assess your hands and fingers, so if you can just open and close your hands, and then squeeze both of my hands, push me away, and pull me towards you. Very good. So that's intact. And then we're gonna be doing, we already did the abdominal reflex, which was also intact. And then can you just wiggle your fingers? Good. All right, next, so hands, wrist, range of motion is all intact. I don't see any abnormalities. Again, no masses, lesions, or anything significant with that. Everything has been expected. So next we're gonna go on to hip range of motion. So if you could just lay flat. And we're gonna do hip, I'm just gonna inspect and palpate that area. Ready, she noted no pain over here, so I can palpate. Any pain?
No.
Okay. Hips are symmetric, no abnormalities there. And then if you can just lift your right leg up straight in the air. Good, put it back down. Your left leg. Good, and if you could just bend your knee, good, and then back down. And then can you, yes, and then go, bring it out towards me, back in, and then for the right one, the same thing. So her range of motion for her legs, hips are intact. I'm going to actually have you flip over onto your belly next. And if you can lift your right leg up in the air, perfect, bend it at the knee, and do the same thing for the other side. Perfect. So next, I'm gonna just have you go back on your belly, or I'm sorry, your back, and then just push against my hand. I'm meeting resistance, against, and again, resistance. And then the other way, and then the other way. So abduction and adduction is intact. No problems there. So next we're gonna do her feet and ankle range of motion. So if you can just, let me see, can you just move up a little bit for this? So if you can just flex your feet, yes, perfect, forward and back, good, and then just against my hands, good, and then just perfect. And then wiggle your toes, and no abnormalities, no ankle swelling, no edema, or anything wrong with her range of motion down there. So that is good. You can sit back up. And then next we are going to test for her cortical sensation. So that was all her cerebellar function. Range of motion is intact, no abnormalities. So for cortical sensation, we're going to start with the stereognosis exam. So I'm going to have you close your eyes, and if you could just identify what I'm giving you in your hand.
Hairbrush.
Perfect. So that is intact. You can open your eyes, and then next we're going to be assessing for the graphesthesia. So I'm going to be outlining something in your hand with your eyes closed, and you just tell me what it is.
A triangle.
Perfect. So that is intact as well. Next, we're going to do 2-point discrimination. So this is assessing sensory. So I'm going to have two Q-tips. So you just have to tell me if I'm touching you with 2 or just 1. Okay, so close your eyes.
2.
Good.
1.
Good.
1. 1.
Good.
2.
Perfect. Okay, and then also just for dullness and sensation, I'm going to the extra receptive touch. So again, close your eyes and just, again, we did this before with the cranial nerve, but she was able to tell me the Q-tip, whether I was touching her with the soft or hard part of the Q-tip. So I'm just gonna do that again on your face. So just
soft, hard, soft.
Good. Okay, perfect. And then we're gonna do
I think.
Okay, so for 2-point discrimination, we're going to be identifying what areas on the body that I'm touching you. Okay, so just close your eyes.
The back of my hand. My knee.
Good. And then for extinction, you should, I'll be simultaneously, she should be able to tell me like if I'm touching 2 points, you know, on same body parts but different sides. So
Both my knees.
good.
1 knee.
Okay, good. Next we're gonna do her balance. So we're gonna first assess her walking. So if you could just stand up and can you just walk in a straight line that way? Good, and walk back to me. Good, and then when you go around, put your foot in front and walk that way. So next, I'm gonna have you come back. Good. Can you just touch your heel, like run your heel down your shin? Good, and then do the other side. Good, so walking is intact midline. I'm seeing no abnormalities. Next, since she's standing, I'm gonna assess her spine. So I'm just gonna palpate. Spine is intact midline. I don't note any lordosis or scoliosis. So if you just bend forward, any pain?
No.
Good, so spine range of motion is good. You can come back up. Intact, again, no pain or anything, so that's good. Next, we're gonna assess her, do the Romberg test, so you could face the camera. We're just gonna assess balance. So if she sways, I'm just gonna have you stand like this for 30 seconds. 30 seconds, I don't see any swaying, so Romberg test, she's okay, no issues there. And then for the pronator's drift, I'm just gonna have you put out both of your hands in front of you and hold them for 10 seconds. If they begin to droop or anything, that would be a positive, and we would be concerned with, for what the reasoning neurologically, like why there would be drift. 10 seconds done, you can put your arms, I don't see any drift, so that's good. And then also just temperature test, so you could sit back down. So I'm just gonna, you just have to tell me if this is hot or cold. Close your eyes.
Cold.
Perfect. So temperature is intact again. Perception is intact, as well as exteroreceptive perception. And that's it.